à toutes et à tous.
Hello, everyone.
Though SARS-CoV-2 is still circulating across the country, COVID-19 disease activity indicators, including daily case counts, lab test positivity, and wastewater signals, are continuing to decline. Currently, hospitalizations remain elevated and variable, but there are signs that severe illness trends are declining as well. Sadly, last week, we were reminded of the serious impact of this pandemic when we surpassed more than 40,000 deaths related to COVID-19 in Canada. To all those in the circle of family and friends who are grieving a loss, we offer condolences. This is a reminder that our efforts are still needed to prevent every death we can. One of the things we've learned about the use of public health measures for COVID-19 in the past 2 years is that they were also very effective in reducing the prevalence of other infectious diseases. So our reduced contact rates may have interrupted transmission of other infectious diseases, such as influenza. When most population public health measures like closures and capacity limits were removed, we saw COVID-19 transmission rates rebound, and now we're seeing influenza activity increasing up to the seasonal threshold, despite the opposite trend being expected at this time of the year. We remain cautiously optimistic that the warmer weather months will give us some reprieve from high transmission rates. Nevertheless, personal protective habits help reduce the spread of COVID-19, as well as other respiratory infections that we haven't seen for some time. While some measures like masking are in use in high-risk settings, the more people who maintain masking in indoor public spaces or crowded areas, the better they will work to reduce overall transmission of respiratory diseases. Masks continue to be an important layer of protection for ourselves, while also helping to protect our loved ones, especially those at high risk of serious illness. There is still uncertainty with the COVID-19 trajectory and variants, and we still have much to learn about post-COVID-19 condition, also known as long COVID. Maintaining a vaccine plus approach can keep us better prepared and better protected against serious illness and other complications of COVID-19 infection, including long COVID. This means keeping our COVID-19 vaccinations up to date, remaining aware of disease activity in your local area, and continuing to take personal precautions, including staying home if you're symptomatic or test positive, improving ventilation, and continuing to wear masks in shared indoor or crowded spaces when with people you don't live with. As we go into the long weekend, a word of caution that COVID-19 resurgences have followed social gatherings during past holidays and long weekends. Let's keep doing everything we can to prevent more illnesses by following the advice of your local public health authority, choosing lower risk activities and settings, and keeping up with essential precautions to help protect the progress we've made and set us up for a better summer and a safer fall. Since we now have 2 individuals confirmed to have monkeypox in Canada, Dr. Njoo and I would be happy to answer questions on monkeypox. Thank you. Merci. Miigwech.
Bonjour à toutes et à tous.
Hello, everyone. Although COVID-19 is still circulating around the country, the current indicators of the disease show that, and the laboratory tests that we see with signals from wastewater continue to show a downward trend. Currently, the number of hospitalizations remains high and variable, but there are signs that the trends are also downward. Unfortunately, last week reminded us about the consequences of this pandemic when we exceeded 40,000 deaths attributed to COVID-19 in Canada. To all those in the circle of family and friends who are grieving a loss, we offer our condolences. This is a reminder that our efforts are still needed to prevent every death we can. One of the things we've learned about the use of public health measures for COVID-19 in the past 2 years is that they were also very effective at reducing the prevalence of other infectious diseases. So our reduced contact rates may have interrupted transmission of other infectious diseases, such as influenza. When most public health measures for the population, like closures and capacity limits, were removed, we saw COVID-19 transmission rates rebound. And now we're seeing influenza activity increasing up to the seasonal threshold, despite the opposite trend being expected at this time of year. We remain cautiously optimistic that the warmer weather months will give us some reprieve from high transmission rates. Nevertheless, personal protective habits help reduce the spread of COVID-19 as well as other respiratory infections that we haven't seen for some time. While some measures, like masking, are in use in high-risk settings, the more people who maintain masking in indoor public spaces or crowded areas, the better they will work to reduce overall transmission of respiratory diseases. Masks continue to be an important layer of protection for ourselves and our loved ones, especially those at high risk of serious illness. There is still uncertainty with the COVID-19 trajectory and variants, and we still have much to learn about post-COVID-19 condition, also known as long COVID. Maintaining a vaccines plus approach can keep us better prepared and better protected against serious illness and other complications of COVID-19 infection, including long COVID. This means keeping our COVID-19 vaccinations up to date, remaining aware of disease activity in your local area, and continuing to take personal precautions, including staying at home if you're symptomatic or test positive, improving ventilation, and continuing to wear a mask in shared indoor or crowded spaces when with people that you don't live with. As we go into the long weekend, a word of caution that COVID-19 resurgences have followed social gatherings during past holidays and long weekends. Let's keep doing everything we can to prevent more illness by following the advice of your local public health authority, choosing lower risk activities and settings, and keeping up with essential precautions to help protect the progress we've made and set us up for a better summer and a safer fall. And as Dr. Tam observed, with the confirmation of our national laboratory in Winnipeg of the first 2 cases of monkeypox from Quebec, we are also prepared to answer your questions. Thank you.
Merci beaucoup.
Thank you very much. And I would invite those participants that have a question to please raise your hand. Thank you.
So if you have a question, please raise your hand. We will start with Crystal Oak from Global. Crystal, I'm going to unmute you. Here you go.
Thanks for that. Can you guys hear me?
Yes.
Great. This is for Dr. Tam. With the lab confirmation of the 2 cases of monkeypox we now have, are there any indicators at this point in time if it is a mutation of the virus? And what is the Public Health Agency of Canada looking out for to signal that?
Yes, the samples from any Canadian cases under investigation are being sent to the National Microbiology Laboratory at this point in time for diagnosis and for verification. And we hope to be able to expand the diagnostic capability to other large provincial laboratories as well. At this point, though, the National Microbiology Lab is the focal point for analyzing any genetic sequencing. This is being looked at as we speak. we understand from other countries that are reporting cases that the current monkeypox strain, or clade, if you like, is the West African clade. We have not yet confirmed that in Canada. It would also depend on some of the quality of the specimens that we get. So, but we will provide that information as soon as we have it. But it will be through genetic sequencing. And I can't tell you the precise time. I know that the diagnosis, once the samples arrived in Winnipeg, was a very rapid turnaround for those initial 2 cases. But we'll see when the sequencing can occur. And then we will know whether there's any connections at all with other identifications globally.
Thanks for that. And as a follow-up, according to the WHO, vaccines that were used to eradicate smallpox are effective against monkeypox. Vaccination for smallpox has dropped off since the disease was eradicated, but the vaccine is still around. How much smallpox vaccine does Canada have stockpiled to combat the potential monkeypox spread? And what is being done to prepare for its distribution if it comes to that?
Yes, thank you for that question. And the vaccines currently being reviewed were essentially developed for the protection against smallpox. One of the vaccines has been considered for monkeypox as well, using both immunogenicity, looking at the generation of immune response, and animal studies. So there hasn't essentially been a clinical trial of the vaccines against monkeypox itself. But I think based on what we know globally, the smallpox vaccines can be applied to monkeypox. In particular, there is one that has monkeypox included in its labeling, if you like. So we are having discussions internationally, but also with provincial counterparts around potential use. And we have limited supply, but we can't really disclose that number just based on security reasons.
On va continuer avec Sébastien Desrosiers.
We will continue with Sébastien Desrosiers from Radio-Canada.
Oui, bonjour.
Yes, hello. I would also like to ask questions about monkeypox. Do you have any reason to believe that there are other cases being investigated elsewhere in the country, apart from those in Quebec, and more specifically in Montreal? And what is the risk of transmission connected with monkeypox? Thank you for the question. This is Dr. Njoo. Yes, with the cases that have been reported in Quebec, it's interesting because it started here in Canada with a case reported in the United States. And when the American authorities did their follow-up, it came out from the background of the cases in the United States. That person made a trip to Montreal. So it began here in Canada, and we were in good communication and in collaboration with our Quebec counterparts to do a follow-up and investigate that in Quebec. But of course, it's possible there are other cases in Canada. So we had a telephone conference with our counterparts from all the provinces and territories, and we identified the contact points for the programs for a possible investigation in other provinces and territories. So I think the most important thing now is really for the entire country to build the awareness of healthcare professionals to be, so to speak, to be properly informed in case they see patients that have any signs or symptoms that might indicate that it could be a case of monkeypox. But also, I think that we need to make the entire population aware, because the symptoms and the signs are very important. It's important to have everyone made aware what the symptoms are. It can start with a fever and possibly headaches and muscle pain, but after that is interesting because it's a unique point with this disease, which is skin outbreak. There are bubbles or blisters that appear on the skin, and it's very important to be aware of that too. There are symptoms or signs like that, and it's important to have a healthcare professional look at it, to go see a healthcare professional to have it examined and to take a sample to have a diagnosis of a possible case of monkeypox. As to the mode of transmission, based on our experience so far, normally it requires close contact with the respiratory droplets or body fluids, perhaps from the lesions, from the skin lesions or blisters. So we remain cautious because based on the experience of the past, it's really connected with travel to Africa. But now we have perhaps a bit of evidence here, even here in European countries, that there are channels of transmission not necessarily connected with travel to Africa. So I think it's important to keep in mind to be cautious to examine potential cases and also perhaps for the authorities around the country to take samples as required in order to analyze them. And I'd like to ask the same question as my colleague from Global. It seems that the smallpox vaccine is quite effective against monkeypox. Countries such as Spain and the United States have purchased large quantities in the last few days. Does Canada have smallpox vaccine, and if so, how much? Yes, thank you for the question. It's interesting because smallpox is a disease that has been eradicated since 1980. We also know that even though the disease has been eradicated, there may still be, how should I say this, samples or perhaps strains in laboratories, and one always has to be ready for a biological incident involving smallpox. So that's why a number of countries, including Canada, do have a certain quantity of doses of smallpox vaccine. It's also true that the vaccine is effective against monkeypox, and even a vaccine, I think it's Immune, which is now also authorized and approved for use against monkeypox. However, for the moment, yes, we do have a certain number of doses, and we're always ready. We're discussing with the province of Quebec about the possibility of perhaps utilization of it. But this is something where one has to continue with our efforts, and also at the global scale to update the orientations or directives for the use, because so far all the indications for smallpox vaccine are against smallpox. But now with monkeypox, of course, one has to study what the indications are and how to go about using it to be more effective against that disease. And with the supply, this is something which here in Canada, we also continue our efforts to perhaps obtain more vaccine. We don't know yet, but if it's something for which we have to use it, we also want to use it for cases of monkeypox. And the indications are mainly for smallpox.
We will continue with Laura Osman from CP.
Doctors, can you hear me all right?
Yes.
Excuse me, I have a sidekick today. I wanted to ask about monkeypox as well. I was wondering if you can give us a sense of how many cases are under investigation in Canada, even just an order of magnitude, and if you could just characterize what you think the risk is in Canada that this virus sort of poses.
Hello, Psychic. Nice to have you around. We get a lot of those on our virtual meetings, I think. So, yes, right now, I would say just under a couple of dozen people under investigation by local authorities. mainly in Quebec, but a couple of contacts being followed up in British Columbia as well, but only 2 cases confirmed. There are samples under processing at the National Microbiology Lab as we speak, so we might expect to hear more confirmations in the upcoming hours and days. I think local authorities are still doing their case contact tracing, so we don't really know the extent to which the spread has occurred in Canada, so that's under active investigation. We do know that, as Dr. Njoo has said in French, that the virus is generally, as we know it to this point, it's generally spread through close contact. And so that could include household contacts, could include other close contacts. And so far, we do know that not many of these individuals are connected to travel to Africa, where the disease is normally seen. So this is unusual. It's unusual for the world to see this many cases reported in different countries outside of Africa. And so I think we will let people know as soon as we get more information. Right now, I can't tell you the exact impact, but I think anyone who have developed some signs and symptoms, including these sort of blisters or ulcerative rashes, and a concern, should seek advice from their healthcare provider. I think at the beginning of any outbreak, we should cast the net wide to try and understand the transmission routes. We don't understand it enough. There's probably been some hidden chains of transmission that could have occurred for quite a number of weeks, given the sort of global situation that we're seeing right now. So we shouldn't rule out new things that we might learn as we go along. This is an unusual situation.
Thank you so much.
Dr. Njoo, I'm just going to add a couple of other points as Dr. Tam's mentioned. I think, if you're looking at monkeypox and the fact that it belongs to the same family as smallpox, as we said earlier, smallpox was eradicated in 1980 in terms of, vaccination campaigns. I think in Canada it stopped in the early 70s. And so I would say generally that the entire population is susceptible to this, to monkeypox. The other part also is that, historically our experience with monkeypox is that it's been travel related. It's someone who's, maybe been exposed to the virus, in Africa and then traveled elsewhere. And so the fact that it's now appearing in, several countries in Europe and so on, and as well as here in Canada, we need to learn more about it. Has it evolved? Has it changed to something different in terms of the mode of transmission and so on? At this point, it's still what we think the mode of transmission that we have seen in the past in terms of close contact, respiratory droplets coming in contact with contaminated body fluids, from the pustules and so on and so forth. But I think we need to be open that that there may be something else evolving and changing. I think the overall risk to the general population is low, but I think the more that people can be, sort of sensitized, socialize, understand that we're all susceptible. And then, to be quite honest, it's interesting. Some of the good practices that we've all learned with COVID-19 serve us in good stead, against a whole host of other diseases, including this one. Good hand hygiene. Potentially if you're feeling sick and have a cough, etc., wearing a mask and so on. So I think those are things that we're looking at, and we'll continue to examine and also develop guidance to help healthcare providers and others in terms of how to deal with this disease as it continues to evolve. Thank you.
Perfect. Thank you so much. I also wanted to ask you about COVID. We've obviously been detecting cases of BA.2.2. So I'm just wondering if you can sort of explain how concerned we should be about this and whether there's potential for another wave given the new variant.
Thank you for the question. So we'll continue to monitor the evolution of the virus. The variants that you were talking about, I'm not sure which ones, but there's a number of BA2 and related variants. We're tracking, for example, BA2.12, BA2.12.1. I think the one that you're referring to is BA2.20. So these are sort of evolution of the Omicron virus and the BA2 sublineage. So we do know that they're probably at least related to that lineage. When we look at some of the parameters, we're learning about that some of them might have increased ability for transmission, a bit more increase in transmission capabilities that are higher than that of the BA2 virus, so the BA2 variant. So we're keeping an eye on it, but so there are always abilities for surges to occur, particularly in under-vaccinated populations. And so that wouldn't be unexpected. What I'm really looking out for, of course, are some substantial changes where there's an entirely new variant of concern that are not Omicron variants. But we will track these. I think even over the summer months, there could be up and downs. We hope we'll, as I said, remain cautiously optimistic and that we'll get a little bit of reprieve over the next couple of months and be ready for any resurgence in the fall. But anything can happen, and we just need to remain vigilant. All of those practices we just all talked about can help keep any resurgences as low as we can and keep a more balanced approach to the ongoing management.
On va continuer avec Olivier
We'll continue with Olivier Ferrand-Bossé from TVA. Yes. Hello, I'd like to return quickly to monkeypox. We're talking about an incubation period that's quite long, up to 21 days before the first symptoms appear. Would this lead you to believe that there may be more cases in circulation at the moment than what has been reported? And does this raise an additional danger that it could be take a long time before we are aware that you have monkeypox, and in the meantime it might spread or you might spread it? Yes, this is Dr. Njoo. Thank you for the question. Yes, we know that the incubation period is about between 5 and 21 days, but at one point, it's 1 to 2 weeks, maybe 6 to 13 or 14 days often. So I think it's important to, I realize that the authorities in Quebec, with their investigation, are doing all the work to follow up with the contacts, the contact tracing, and there are a number of suspected cases. And we are in the process of receiving samples from the suspected cases in Quebec. And apart from that, I cannot really predict what's going to happen, but it is important to continue the work in the field, and we'll see what happens. And as I said previously, and we have to build awareness and discuss it with all the provinces and territories, because as Dr. Tam mentioned, even with the case from the United States, we know now that there are also perhaps possible contacts in other provinces such as British Columbia. So it's important to continue our investigation, not only in Quebec, but perhaps across the country. Okay, thank you for that. And I would like to follow up on COVID-19, specifically the B2.12.1 variant, which now accounts for 43% of the infections in the U.S., which breaks out from the vaccines and from acquired immunity. Does this raise a concern for a more rapid wave that could occur here in Canada as well, and an increase in cases such as we see in the U.S.? Yes, thank you for the question. For the moment, we're continuing to monitor that variant and also all the other variants that are emerging. And to be a variant of concern, well, it's always the three main questions that we ask: whether it's more transmissible possible, whether there may be more serious consequences, and as you noted, whether there may be a breakout from the immunity from vaccines or even acquired from a previous infection in the community. So thus far, we're continuing to monitor that. We're not in the same situation as the United States, and that's why it's very important to continue with our efforts to encourage people to wear a mask in certain settings and also to increase our vaccine coverage, even though it may not be as effective against transmission. Thus far, we see that vaccines provide good protection against serious consequences, and that is very important for our healthcare system. And it's always important, too, to encourage everyone. It's always another increase of protection from booster shots. So we encourage people to have a third dose if you're eligible for that. And indeed, all adults aged 18 and up are, and also the approaches of our National Advisory Committee on Vaccines. There are a number of people, for example, people aged 80 and up should receive even a fourth dose. So I think this is something to keep track of, and we will see what is going to happen during the summer, and we don't know exactly what the situation is, what's going to happen with the other variants. So it's not only that variant, but in general, we do continue to monitor all variants, and we continue to plan for all scenarios involving the variants. We'll continue with Dylan Robertson.
Hi, doctors. I want to thank you for continuing these briefings and for following through on having the fourth dose data posted online. I wanted to ask about Ukrainian refugees and vaccination. Less than half the population of Ukraine is fully vaccinated. You don't need shots for the emergency travel permit. I don't want to stigmatize asylum seekers, but I'm wondering what role FAC has in helping provinces to make sure that these shots are available to newcomers, and what you think the provinces should have in place for these newcomers, given that some Canadians are having difficulty finding COVID shots.
Thank you for that question. And I think provinces have been very collaborative in terms of supporting Ukrainian new arrivals, and including providing information, and in collaboration with some NGOs that support newcomers to give them information, including in appropriate languages, so that they understand the need to get the vaccination. And so there is a, even though there's no requirement to entry, there is a federal requirement to get the vaccine within a certain period of time. So we wanted to make sure that everybody who arrives here understands that, and that the provinces are able to follow up with them. I'm not certain about the accessibility on the ground, but as you know, we have a lot of vaccines, and they can be accessible in so many different ways in local areas, but they are different distribution points. So I think I would encourage anyone who has arrived recently from Ukraine to make sure they know how to connect with their local public health authorities, or even the local pharmacists. But yes, we are trying to work, other departments, not necessarily the agency, is working with arrival, such as IRCC, for example, to make sure people know to go and get their shots. And of course, they'll all be provided free of charge.
Thank you.
Dr. Njoo, I would just add an additional point. If you're looking at the newcomers from Ukraine, but just newcomers in general, taking a more holistic approach to migrant health, it's important to obviously welcome them and have them connected to a healthcare provider. And as a healthcare provider, I wouldn't just be focusing on COVID-19, but really looking at all of their vaccines. Are they up to date in terms of other vaccines for the children, the childhood vaccines, and for the adults? Do they need other vaccines to be up to date? So it's not just about COVID-19, but I think just sort of good vaccination practices and being up to date with all of your vaccinations. Thank you.
Thank you. And on monkeypox, we've had other countries note that men who have sex with men appear to make up a disproportionate number of cases. I'm wondering if that's happening in the suspected cases in Canada, not just the confirmed ones, and if you have any advice for this group or thoughts about stigma.
Thank you for the question. I think, as I said earlier on, we need to look at all modes of transmission. We do know it's close contact, usually respiratory droplets. But if you're in close contact with infected secretions, including from a pustule or an ulcer, if you have a mucous membrane contact or a cut, for example, that could be different ways of which this virus can pass on. And an interesting thing about this virus is also that we think it can be transmitted through contaminated clothing or what we call fomites. So, I think the public should be aware of that. There may be certain transmission settings and groups of people currently experiencing the most cases, but I think I would urge a caution as to, essentially focusing on a particular group of individuals. Certainly, we will provide support and information if we are seeing increased cases in certain populations and make sure they get the information that they need. But I think people should understand that it's close contact. And that could happen in different ways. Households, we heard households in the United Kingdom. So that this is why we must not focus on a singular group of individuals. But we do need to make sure that we have targeted approaches that would help individual groups. Not everybody gets the information in the same way. So we will be linking up on different channels with non-governmental organizations, as well as the broader messaging to make sure everyone gets the same information.
Autour d'Émilie Bergeron.
And now, Émilie Bergeron from La Presse Canadienne.
Oui, bonjour. Vous avez dit
Yes, hello. You said earlier that you're looking at the possibility of increasing the capacity for diagnosis of monkeypox elsewhere in Canada, outside of what's been confirmed by the National Microbiology Center. Which places are being looked into to broaden that capacity? Are there some priority sites in the scenarios that are being considered? Could you summarize what we know about those considered scenarios, please? Thank you. This is Dr. Njoo. Perhaps I can start. Yes, that is a very current issue, and we know that our laboratory in Winnipeg is in close communication and collaboration with the network of laboratories, provincial laboratories across the country. I think we may begin perhaps with the provinces that are the largest, that have the most capacity, but I cannot give you the details because I'm not aware of that. It's really a discussion of a technical nature between our laboratory and the laboratories of the provinces and territories. And normally, it's also a question of what is the state of the technology and the capacity of those laboratories in the provinces and territories. And of course, our national laboratory is ready to support all the provinces and territories, but perhaps it would be feasible if we start with the provinces where there's already a certain technological capacity to add something additional to be able to diagnose the monkeypox. But this is work that is ongoing for the coming days and weeks. And I could add that owing to COVID-19, we have more capacity for diagnosis, from molecular diagnosis now. Thank you very much. And if I understand, it's likely to be the provinces that are larger or that have a better technological capacity. But do we already know which provinces it might be? Because we already know that Ontario and Quebec are the largest provinces, but will it necessarily be them, or is it too early to say? This is Dr. Njoo. I can't really say, I cannot speak on behalf of the laboratory. Of course, our laboratory is in contact with all the provinces and territories, and this is something which, as things develop, and the discussions continue between our laboratory and the provinces and territories.
Let's move on to Andrew Davidson from CBC. Andrew, are you there? Okay, we'll move on to...
Hello.
Oh.
Hi, sorry. It's actually Lauren Pelly from CBC News.
Go ahead.
I would hope you could explain a bit more about possible vaccination strategies for monkeypox. So we know that in other countries, including the UK, is now exploring the notion of a ring strategy where you vaccinate using the smallpox vaccine healthcare workers, close contacts of potential cases. Is that a type of strategy that you would be interested in exploring at some point?
Thank you for the question. Yes, those are some of the strategy that we're exploring in connection with the WHO and the UK and others. And as Dr. Njoo had indicated, Quebec had some interest in terms of some of the contacts. So that is under discussions right now. But of course, we need to know some of the epidemiology as quickly as possible. So the vaccinations can be used for a preventive measure prior to the exposure, or if you were post-exposure, there's also potentially a window of opportunity to get vaccinated. And so we're looking at all of those. As someone had already mentioned, there's a long incubation period for this virus, and there may be a window of opportunity to provide a vaccine to certain perhaps higher risk contacts under those circumstances. So these are under active discussions as we speak.
And one more question on that front as well. We've heard from public health officials in Montreal for the general public to not worry that you can't get this in a grocery store, you can't get this out and about in public at this time. But how do we know that at this point? Because we're also hearing from virologists that there are major questions over, how this virus may be evolving, and are we seeing changes in it that could signal, a shift in how it transmits between people and things like that. A lot of unanswered questions at this point. So what is your take on sort of what the real risk is to the public going forward, and what do we still need to understand about this virus before we can determine how much of a risk it poses?
Mm-hmm. So I think it's probably reasonable to think of this virus as one that is transmitted through close contact, as we've just described, the respiratory droplets or exchange of bodily fluids, or from blisters or ulcers or others of the skin lesions. But we should, of course, remain open-minded as we begin to investigate this rather unusual event of spread beyond Africa. I think one of the fundamental questions from my perspective is, for example, the role of asymptomatic and infected individuals. We haven't got to the bottom of some of these transmission chains. These are just beginning to be explored. Most people haven't traveled. So how is it being transmitted? I think we are basing the current information being provided to the public based on what we know, but we may learn more as we go along. So I think you're right. We need to reserve some some of these risk assessments as we go along with the investigation. But in general, it's not something that you can catch in a casual contact setting.
Okay, I don't see any more raised hands. If the doctor allows, we might allow maybe one more if somebody has an extra one. I see Dylan. Okay, Dylan, I will let you ask your question. Here you go.
Sorry, I always have questions. Dr. Tam, there's a widespread disparity in eligibility for fourth shots, and we're seeing that reflected in some of the provincial uptake so far. The age to qualify is spanning from 18 to 50 to 70. The NACI Council is still sticking with the guidance for 70 and maybe 60. Do you think that needs to be reviewed, or is it prudent to hold on to these doses for now if the wastewater is trending downwards?
Yes, the National Advisory Committee on Immunization, as you indicated, had provided their recommendation, and which is focused on the highest risks, based on the data that we have in terms of the incremental benefits of that fourth dose. So I think the committee is always reviewing evidence on an ongoing basis, but is not making any changes to its recommendations at this time. I do know, of course, provinces are making the vaccine more accessible should the public want this, and they should know, anyone who's getting that fourth dose, that, of course, is off-label use. But to the extent that we have the information at this point, it appears that the side effect profile isn't any different. There is no increase in side effects compared to the preceding doses. So I think with that in mind, anyone who gets the fourth dose should make sure that they know all the information as they're going to get it. What you've described, I think you're trying to ask is, the timing of boosters. And I think that's a reasonable point, in that if booster doses, they do boost the vaccine effectiveness against infection and transmission, but that wanes over time. So as this current pandemic wave may be coming down, of course, some of the thinking is that maybe that this, we will focus our attention towards the fall. But having said that, we can never guess when that next variant might come up. So these are some of the difficult decisions as we're going about a vaccination strategy. But in any case, I think provinces are knowing that they have enough vaccines is making that fourth dose more available.
Si vous permettez, j'en aurai une dernière.
If you don't mind, I have one last one in French. My colleague Sébastien Desrosiers, and after that, I can assure you that will be the end. Over to you, Sébastien. Thank you. That's very kind. I wanted to talk to you about baby formula, infant formula. There's a shortage of infant formula that is hypoallergenic for babies with food allergies. What is the current situation, and what is the strategy in Canada to make sure that those who need it have access to that product? This is Dr. Njoo. Perhaps I could start off. Yes, we're aware of the situation, and we know that it started in the United States, but it still has impacts in Canada. And right now we know that our counterparts in Health Canada are in close communication and collaboration with the manufacturers and so on, and also with their American counterparts to keep track of the situation here in Canada. And we continue to work to ensure that we will have, so to speak, the infant formula here in Canada. But of course, we're starting to see some impacts here, and we're continuing to work with all of our partners on that. So that concludes this press gathering. Thank you very much, Dr. Njoo and Dr. Tam, for your time, and have a good day, everyone.